Hi, everybody. It's Susan from Susan's New Era. I'm coming to you today to discuss same-day surgery. Yeah, I worked it for 20 years, so I've had a few day surgeries, so yeah, I know. Anyway, so if you or someone you know is anticipating surgery, there's a couple things that I would like to clear the missed questions that you may have about having day surgery. So this is the scenario I'm going to create as an example. You or your loved one has gone to their doctor and something needs to be surgically fixed, or something has been found, or maybe you're going for something in plastic surgeries. Okay? Your doctor will then refer you to a specialist, and after discussing what they plan on doing, if it's insurance covered, they will make sure that it's covered, and if there's any copays, or if it's private pay, they will make those financial arrangements. They will then assign you to a surgery center or a hospital that has a same-day surgery. You'll get a date. You'll do any preoperative tests or exams that need to be done, any labs, EKGs, chest x-rays, whatever it may be. After they figure out that you're well and good to go through surgery, they'll give you a date. Then typically most same-day surgeries or surgery clinics have a pre-admit testing department. And the pre-admit testing department will go over your health history. They will most likely look at your labs, your x-rays, make sure everything's done. They will go over your medication list, so make sure you have the most current and update list. Know what your medicines are for. If you have any question why you take a certain medication, there's one of two people you can ask. You can ask your pharmacist, or you can ask your primary doctor, or the doctor that prescribed it. Know your medicines and know what the milligrams are and how often you take it. Now, pre-admit testing will give you instructions on when you can last eat or drink anything, such as nothing by mouth after midnight, when to take your blood thinners, if you're on a blood thinner. If your pre-admit testing doesn't know, make sure you call your surgeon's office. They will tell you when to stop your blood thinners, when to stop NSAIDs, when to stop supplements. And then typically you are given a date if they haven't already given you that before. And then usually you're called the night before, the day before, the night before, what time to check in. Now you as a patient must make sure if you're going home that day, you have someone to drive you home, and that you have someone to stay with you the night of, after surgery, that night. So you go in and you check in for your procedure on the day of surgery. Typically you get there about 2 hours, maybe every facility is a little different, but we'll say like 2 hours before. You're not going to instantly be rolled back for surgery. There's things that the nurses have to do. They have to re-ask a lot of those questions to make sure everything is correct and current. No changes to your health status. They're going to make sure you don't have any new or long-standing colds, flus. They're going to ask you when you took your last medicines. They're going to go over your medication list. some medicines are very important and can have ill effects on you, such as your blood thinners, your blood sugar medicines, when you last took NSAIDs, and make sure you have been told by your surgeon or the pre-admit testing when to take your blood pressure. So many times they do want you to take your blood pressure on the day of surgery, but ask your doctor or the pre-admit testing. Very important. So know when to take your blood thinners, your diabetic medicine, and your blood pressure medicine, because typically they do want you to take that. So they start an IV so that they can do the anesthesia medicines, and it's also for in case there's any emergencies. It just makes things work out better. Yeah. And they have you possibly cleanse with a antimicrobial wipe prep cloth. It may be just a certain part of your body, or it may be almost the entire body, excluding the face, the privates, and the bum crack. Okay. Many times they do have you use a antibacterial soap, either a prescription soap or like antibacterial soap. It's all part of trying to prevent surgical site infections. We as humans have a natural layer of microbial growth on our bodies that happily lives there, but you get surgery, you're disrupting the hemostasis of the body, and yeah, we don't want infection. So do what they tell you. Ask if you can have your support system with you. Okay. Usually a lot of institutions kind of limit it to one person at the bedside. You can have all the other, all your personal cheerleaders that you have. They can be changing your sheets, cooking you soup, making sure you have flowers at the bedside. You can assign them. If they want to be there to support you, yeah, you can find things to keep them busy. So after you're checked in by the nurses, you will usually be in a holding area. They might move you to that holding area, or that might be part of the area that you're at right now. In this holding area is usually with anesthesia will come talk to you. They might look at your IV, they're going to go over your chart, and they might ask you again, no surprises, when you last took this medicine, that medicine. They might ask you about your health history. So, yeah, get to know your health history, get to know your medicines. Yeah. Anesthesia will explain what they're anticipating. They'll explain their plans for your anesthesia. And typically at this point, if you have not signed a consent for anesthesia, you will be asked to sign the consent. You can always refuse any surgery, but then you have to think about it. I've had many patients leave who decided not to have surgery, and a week or two later they come back after reconsidering it, and there was a whole lot of things that they had to redo. So it's up to you. You wear your big boy, big girl panties, and you make your health decisions, and you decide if this is really what you want to do. Okay. So after anesthesia, sometimes they'll slip a little joy juice in your IV, or sometimes they won't. They take you into the OR room. Many times you're awake, and you're asked to shimmy over from your gurney onto the OR bed. You're talking to the anesthesia. You're talking. And before you know it, you're waking up in recovery room. Recovery room is the area that you are coming out of the deeper part parts of anesthesia and waking up, and pain control. Different institutions have different amounts of time for anesthesia, but it's usually to where you're coherent enough to be able to speak, think clearly, and be moved back to the area where you're going to be discharged from. After doctor's orders are received to discharge you home, you will be given instructions, and this is where it's really important to have your important person there at the bedside to listen to those instructions, because you are not going to remember everything they say. Remember, you are under the influence of anesthesia. Just because you woke up from anesthesia doesn't mean it has completely exited your body. It takes up to 24 hours for your body to get rid of all that anesthesia. So that nurse will go over your discharge instructions. They'll go over your medications that have been prescribed, whether you've already picked them up. And they'll give you usually a handout with your instructions. And if you don't already have a follow-up with your surgeon, usually there's a amount of time that the surgeon wants to see you, make sure you're healing. Your belongings will be returned back to you. You get dressed. And then usually your driver, support person, brings the car to an assigned area, and you are wheeled out and you are assisted into the car. So you may say, well, I'm only having a little surgery. Why do I need somebody to spend the night with me? There's a couple reasons. Remember that anesthesia running through your system? Yeah, some people can be nauseated. Some people can have blackout memories. And some people, if you're maybe bleeding a little bit, aren't coherent enough to call for help. So they need somebody to assist them when you're at your most vulnerable. So, know your medications. Know what they're for. Listen to the pre-admit testing instructions. Do not eat anything or drink anything after midnight unless otherwise given other instructions. Have a driver. Have somebody to spend the night with you. If you do not have a driver and you do not have somebody to spend the night with you, determine that a couple weeks before surgery. Doctor may have to either change the location of your surgery to maybe a hospital that can keep you overnight. Yeah. Do not drive yourself home after anesthesia, and have somebody spend the night with you for safety. So this is my beginning on a series about same-day surgery. So if you have any questions, leave a comment and I'll try to cover it in a future video. I hope all is well with you. I hope you don't have to plan a surgery. But if you are informed, you can be a better healthcare customer that has a better outcome. Knowledge is power, especially in the healthcare realm. As a patient myself, success is not just the surgeon, not just the anesthesia, but the power that you have given yourself to gain knowledge to get where you want to go. Anyway, Same-day surgery, Susan. Well, retired same-day surgery, Susan. Susan's new era.